Hi, Kenzie here. It used to be that transgender people only had one option when it came to vaginoplasty. These days we have a number of options, so I thought I'd go through these and see what works for you. Number one is a zero-depth vaginoplasty. It's generally for people who have high risk for surgery and people that do not plan to have sex. It looks the same. It looks like a cis vagina. It has far less risk and does not require any hair removal. Okay, number two, intestinal or sigmoid. This uses a section of the lower intestine. It is done laparoscopically. It uses a portion of the lower colon for the vagina. It has its own blood supply. It's a larger diameter, which means dilation to proper size is easier. It's not smooth, but a rough texture. It has excess mucus, and that mucus tends to have a bad smell. It is self-lubricating and very stretchy. Number three, peritoneal or PPV. This uses the lining of the abdominal cavity, which is called peritoneum. It's just used to create the vagina lining. It is a laparoscopic procedure. It is self-lubricating. It requires a bit less dilation, and depth is generally not an issue. Number four, the McKenzie. Vagina is made using skin graft. It is placed on a vaginal mold and placed into the space where the vagina will be. The mold is used consistently for the first several months after surgery. The mold is removed occasionally for cleaning. It is not self-lubricating, and it wants to heal like a wound. This requires lifelong dilation and cleaning. Number five, buccal mucosa. This uses the lining of the mouth. The tissue is very similar to cis vagina tissue. It is hairless. It is self-lubricating. It is a good tissue. However, you can imagine there's not much tissue available in a mouth. So I imagine there must be depth issues because you just don't have enough tissue. Number six, penile inversion. This is the old standard technique. Skin from the outside of the penis is removed and inverted to create the lining of the vagina. The head of the penis is reshaped to create the clitoris. Finally, scrotal skin is used to create the labia major, majora, and minora. Disadvantages are similar to skin graft. Hair must be fully removed so there is no hair growth inside the vagina. Regular lifetime dilation is required. It is not self-lubricating and needs to be cleaned regularly. And now, my favorite, the jejunum vaginoplasty. This is what I chose. It uses tissue from the small intestine. It is smooth. It is self-lubricating. It is self-cleaning. It has a spiral muscle that can contract. It requires less dilation than other methods. There are no depth issues. And it is said that dilation is only required for about 1 year. I'll let you know on this. This one makes an obvious choice for me. And the future I'm hoping for in SRS is pre-stretched tissue, so we don't have to dilate for the first few months and go through the pain. But right now, that's what we have, and that's what we must do. And that's what I have.